Joining us now, our good friend J.C. Hernandez. He is the director of the Virginia chapter of Americans for Prosperity. And J.C. and his team in Virginia have been at the forefront of telemedicine. Now, I'm experiencing this, J.C., before you get on myself. My own doctor, Dr. Muscle Manny, in Chesapeake, well, he went to telemedicine after they said it was okay. So the last 2 times I've interacted with him is over a video where you do the video live thing, and I've been able to describe my symptoms, and did it too, so that's 3 times we've done it with him, describe my symptoms. One time she had an infection in her toe, so she sent him a picture of it, right? And he prescribed what she had to prescribe, and we're both better. Didn't have to go to the doctor, didn't have to wait in line, didn't have to sit there with all the other sick people, didn't have to do any of that, just did it, telemedicine, perfectly, and it worked out great, and we were fixed up in no time. This, I think, is the future. And the whole idea is we've always been at the demand side, right, of healthcare. JC and Americans for Prosperity have focused on the supply side, increase the supply of care to meet the rising demand. And he's joining us now with his op-ed that ran in the Virginia Post the other day. JC, great to have you.
Great to be with you, John. And also, Ben's with me as well.
Hey, Ben.
You're exactly right, John.
Well, yeah, I mean, I think I've kind of outlined this for you. Tell us about the changes that were made in Virginia in this session towards telemedicine. I just went through my experience with it. I also have my mom with us. We all have the same doctor, Muscle Manny. And she had swelling in her ankles the other day. We did the same thing with him. We did the video chat live. It was like at 7:30 p.m., so he was already off hours. And we put the video right on her ankle. He knew exactly what it was. He prescribed something. I went and picked it up, and that was the end of it. Why can't this work for everybody?
It can. It can work for folks in rural areas, urban areas, suburban areas. And here's the beauty of it is that it's a quarter of the cost of actually going and visiting your doctor. We know it's a lot safer because you're doing it from your house. And, it's not to say that it's not for every single case, but it's a good determination whether or not you need to go and walk into an emergency room where you can, contact a plethora of other diseases that may be out there. You don't have to wait in line. It's immediate. And if it's not an emergency, like you said, you can go directly to your nearest pharmacy and pick up your prescription. And if it is an emergency, your doctor has his or her duty to let you know that, hey, you really need to call 911 and go to the emergency room, right? So it is a great buffer. It's a cost saver, and it's shown that it's the technology, not of the future, but technology that exists right now.
Ben Knott's involved here. Ben, you're the legislative director for Americans for Prosperity in Virginia. We had you on our show throughout the General Assembly session. You had some great success. Tell me about what actually laws in Virginia were passed to open up telemedicine, and be as specific as you can.
Yeah, so our big goal this past session was to, one, fund remote patient monitoring so that you could get reimbursed if you're a doctor and you want to monitor somebody remotely, such as somebody that's got a heart condition, somebody who has something that you would have to just sit in a hospital room and have your nurse check in on you, but they don't think you're going to die. They're just monitoring you. Well, that was a big thing we wanted to get funded. That's something they pulled out at the end of it all. They've funded it now, given the crisis temporarily. We hope to make that permanent. The big thing that we're very excited about is in building a state telehealth plan. This would put Virginia miles ahead of any other state. Basically, what it would do is that to really leverage telehealth in new and exciting ways, we've got to get everybody talking to figure out how they can collaborate together, from the internet companies to the I'll give you a scenario. Let's say you call 911 and say, I feel like I'm having a heart attack. The EMT can come to your door and they can connect you with a doctor using telehealth right there. The EMT can treat you with a doctor doing telehealth, and the doctor can say, you're fine. We just went over all your symptoms. and we're going to actually we're going to call you in a prescription. Don't worry, you don't have to go anywhere. We're going to deliver it by drone. And you can get emergency quality care in your home. Everyone can get reimbursed from that. The EMT, the doctor, the internet connection strong enough that you get the top-notch care, and they deliver you a prescription to monitor you, and then they give you a little device and they monitor you in your home. And you just avoided going 4 days in an ER when you really didn't need to. Mm-hmm. That's the future, and that's the getting all these parties to collaborate about how they can do telehealth, not how they're doing healthcare right now, but how can we leverage these technologies to deliver care in new and exciting ways that really is an improvement to the consumer and the customer and the patient.
You're on the John Fredericks Radio Network. We're live today in Chesapeake in our home studio. Kara Johnson, Al Green, John McCune, all our team in Richmond. We're with Ben Knotts, the Legislative Director for Americans for Prosperity, Virginia, and J.C. Hernandez, who is the Virginia Chapter Director for Americans for Prosperity. Let me ask you this, J.C., in your op-ed. Obviously, with the coronavirus, stay-at-home orders, and people don't want to have contact with others, I mean, the last thing you want to do is sit in a doctor's office, right? I mean, that's with other sick people. I mean, that's right. Just the last thing you would want to do, mask or not. During this trying time, shouldn't this be something that everybody should try? And it's so easy to do. I mean, everybody has an iPhone now or a computer. Everybody can do video conferencing. I mean, it's 5 minutes. Everybody has an app for that to set up. You hate to say that, maybe because of this it would accelerate it, but wouldn't now be the time for anybody to try it?
It is, right? And it's beyond that. So we saw one of the first actions that the president took immediately after they declared that this was a pandemic was to essentially do something that was very, very similar to what our bill, HB 1332, did. And that is what Ben was just talking about, right? Allow for remote patient monitoring and reimbursements through Medicaid. And so we know that nationally, this is the way to go. Other things that Virginia did, that some other states did as well, is relax the licensure component around the states that surround Virginia. Now, we'd like that to go nationwide, but essentially what that means is that somebody would be able to visit any doctor within the United States, regardless of where they reside. And the reason why that's important is because it increases the amount of doctors that are available in a 24-hour time period. In addition to that, we also saw that many states relaxed their certificate of need or certificate of public need stance. And why that's important, and we saw that almost immediately. Why that's important is because we know that one of the biggest issues was that there's, quote, unquote, not enough beds. But there's only not enough beds because their government says that there's not enough beds. It's not just a hospital or facility couldn't provide more beds.
Right. So certainly the other thing this does is open up beds, which is, one of the big issues with the coronavirus. What legal roadblocks now are in between really expanding telemedicine in Virginia? What else has to be done to really open this up where it becomes, kind of the thing you do? Because even when I was sick about 2 weeks ago and I needed to go to my doctor, so what I did was about a month ago, right? So I called up their office, and they're like, no, don't come in. We'll do it by video. Dial them in at this number at 7:15 p.m., which I did and hooked them right up and went. But my first reaction was to just call the office, right? That was my first reaction. What legislative roadblocks are still in the way?
So, luckily in Virginia, Ben and our team have been really working on telemedicine for several years now, and so we've been able to break down a lot of barriers. One of the things that we would still like to see is allowing for, online prescribing. We have some bills that were in the works that hopefully they'll get signed soon and allow for telepharmacy, which it will actually speed up the process, and also delivery. So there's several options now that the technology exists to be able to deliver the prescriptions directly to your house. So let's say you are sick and your doctor just prescribes something to you to your nearest pharmacy. That pharmacy is then able to deliver that prescription to you, whether it's through a driver or through a drone, through other means. And so that's kind of like the next level of care that we would like to see via the telehealth realm. And also, like what I mentioned before, the licensure component. And the reason why it's so important, like I mentioned, is that because that increases the amount of doctors that are available and the amount of experts that are available. And also, let's say you have, something that's wrong that the doctor that you're currently seeing is not an expert in. They can call somebody else in from anywhere else within the country and be able to chime in into what they think, the issue is with you.
I think telemedicine is definitely the future here. There's no question about it. And all you have to do is experience it one time. You say to yourself, why am I going to a doctor? Now, it's different when you have, like you said, you have an emergency. You got to go to the emergency room, and it's something dire. You have a limb maybe that got fractured or something like that. But if it's a normal thing that you just want to talk to your doctor about, whether you think you're sick for some reason or you have a stomach flu, or like my wife had she got something caught in her toe, and we were out walking in the back, and her toe got infected, and sent the picture of it, went until, got the prescription she needed, cleared it up. But my question is, gentlemen, AFP, how do we go from, wow, telemedicine, cool new thing, to that's people's first choice? Do you know what I'm saying?
Well, John, let me kind of like paint a picture for you. Is that one thing is that the context that we live in now is so new, and it is really making people think, how can I use this technology? My wife knows I've been working on this for years in Virginia. She did her first telemedicine conference the other day when our little girl got sick, and she said, I don't want to take her to the waiting room.
Right.
And so she did it in the kitchen. But she's been doing this for years. This has made it an active necessity for a lot of people, and once these things happen and they learn and they interact with it, there's no going back. And that's something that's really key. I think that this is going to provoke people to start using it more often, because now they can make it a part of the regular regimen when they want to get care and they know it's nothing serious. And the other thing to kind of piggyback the question you just asked a second ago, you said, what are some of the things that still are in the way with us doing more in Virginia? And I want to just provide this little bit of insight. A lot of the way our care providers, and especially the big systems, they build their budgets based on doing things the way they've always been doing them. And anything new or an anomaly that they come in, they're excited about the technology. And a lot of hospitals leverage telestroke technology. But for the most part, they're figuring out how we can keep doing things the same way and just add this onto our table of options that we use. But for the most part, they're still wanting to use the same budget, the same methods, and then test these things slowly and interact with them. What this has done right now is it's radically made them rethink about how they're leveraging this technology, and they have to do it out of survival. I know a lot of people that work in the healthcare systems, and they said this is how they're actually able to stay profitable, because these services are affordable, they're profitable, and they can do them remotely and still see people that otherwise wouldn't be able to come into the hospital. So these barriers to really people thinking financially, we can't change the way we budget, we can't offer these new services because we just don't know about them. Right now, people are doing it out of necessity. And again, I think this is going to provoke people to say, let's permanently make these changes for reimbursement. And let's also let people, provide the information in unique ways, whether it's through data, where they have an agreement with the provider to provide their data directly to that provider, and the provider can keep tracks on it, and they can figure out things that they wouldn't know otherwise because they're getting more data about their patient, not just a 10-minute conversation. There's a lot of stuff on the forefront that's going to radically transform the quality and cost that, believe it or not, was actually the barrier for some people not wanting to change.
You know what? I love what you guys have done on this, and all you have to do, like your wife has done, is experience this one time, get the results, see how easy it is, and I guess the next step is to be able to open this up across state lines, right? When do you see that happening?
From a timeline, there are big barriers. I want to call them barriers. Our partners in this are people that are very concerned about having people licensed in different states care for Virginians. And if they do a bad job, how does the Virginian hold them accountable? So we're working through those issues, and the Board of Medicine of Virginia has been very forward-thinking on telehealth and They're studying right now how to get reciprocal agreements with other states that have similar board of medicine, similar methods. So I'm hopeful we can get this done soon. If we start, but the big thing, John, is we need our legislators to start thinking in terms of the rights of a patient. A patient has a right to talk to a doctor in a different state if they feel like that doctor is going to save their life or improve their quality of life. It's between the patient and the doctor. We shouldn't let a bureaucratic rule get in between the best health care a Virginian sees for themselves.
You're on the John Fredericks Radio Network, and we are with J.C. Hernandez. J.C. is the director of the Virginia chapter for Americans for Prosperity. They've been working very hard on telemedicine. He had a great op-ed in the Pilot, I believe, on Friday, called Build on Promise, the Potential of Telemedicine. We're also with Ben Knotts, who is the Virginia Legislative Director for Americans for Prosperity, obviously in Virginia. Gentlemen, I've got another minute. I'm going to let J.C. close on this. J.C., top priority for telemedicine in Virginia when they reconvene in 2021. What is the main thing in telemedicine you want to get done?
Well, I think Ben just summed it up there at the end. I think while we're working through the funding portion of it, and that's something that we still need to just kind of pick up and make permanent from HB 1332. We want to make sure that that's worked through. The governor has till the end of this week to sign that bill. It's something that we want to make sure that we are funding, so that folks that have Medicaid are able to get reimbursed through that. But secondly is continue to talk about, and with other states and seeing how we can work on those licensure agreements. We want to make sure that as many folks as possible have access to telehealth, regardless of where they live in Virginia.
All right, that's going to sum it up. I want to thank you guys for your time today and for all your great work. And again, it's always great when you have guests on and the host has experienced it himself or herself. It just tells a much better story. I've just experienced this 3 times now with our own doctor, as Dr. Musselmani in Chesapeake. He's an active participant in it. I never want to go to the doctor's office again. Like, why would I want to sit there and wait for an hour? Like, why would I want to do that? Plus, did you ever read the magazines they have in there? I mean, do doctors have those magazines in there? Is that like is there like a doctor's network of, why don't we all subscribe to the stupidest, worst magazines that nobody will ever read and put them there, and they're all 6 months old? Like, why would you want to do that? I don't know why anybody would ever do that. John Fredericks Radio Network, thanks for being with us